Continue our conversation on the worst ever Ebola outbreak. Dr. Asare, there is, of course, this issue that we cannot stop talking about, the fear, and also the stigma that is being attached, even those who have actually recovered from it. How do you reach into the minds of people and help resolve this issue?
Fear is much like a virus, and education is the cure. We have to be able to talk to individuals, their families, their friends, let them know that this illness has been contained, the individual has recovered, and this is what we can do to move on. It's not something that's going to last, but we have to let them know these basic facts.
Dr. Akukwe, there was a mention of infrastructure and the structures within the health system. Do you think this could be an awakening to African leaders to build and develop the infrastructure so that whenever there is an outbreak like this one, we don't get into that situation where you really are humiliated and embarrassed by the inability to handle it?
Yes, I think the Ebola outbreak is a wake-up call. It's a wake-up call for African leaders and also a wake-up call globally. So, and one of the things that I expect to happen when the emergency situation is contained is for an international public-private partnership to look into rebuilding health systems in Africa. Because without a viable, robust health system in Africa, you're going to be having other outbreaks. And as you know, Lassa fever is still endemic in some of these affected countries. So maybe next year we'll be talking about Lassa fever. So I think this is a wake-up call.
Now, I was wondering, there seems to be now an international interest and commitment to fighting this outbreak, but how does this translate in terms of tangible action on the ground? What do you make of it? I mean, we know how to stop Ebola, we know the steps at least, but this outbreak is still ongoing.
Yeah, I think the international community is adopting two steps. One is the emergency response, so led by the UN and the US government. Then the next response will be when Ebola is contained, how do you strengthen those health systems? And my understanding is that is also on the table, that all the affected international partners and local governments in West Africa are working together on this. So I'm very confident.
Now, Dr. Asare, there are actually reports that some people who have recovered from the Ebola virus, including medical workers, are still seen as dangerous to be closer to. Some are willing to go back to the communities. And now, what do people need to know about a person who has actually been infected but has recovered?
They need to know they should not be afraid of them anymore. That as long as they recovered, they're not showing symptoms, they are fine. There is one thing to note, however, men, in the semen, the virus lasts 7 weeks after recovery. So any man who has recovered from this should abstain from sexual activity for at least 7 weeks.
And Dr. Akukwe, there were also reports about a person developing immunity after they have recovered. So would they be even better placed to be in a potentially, a situation where they could be infected?
It's possible. It's possible. And there is also a report of having blood transfusion from those who've recovered. But these are all experimental medicines at this point in time. So nobody really knows what will happen after you've recovered, down the road. Because in the past outbreaks, the contact tracing mostly stopped when somebody recovered. There was really no follow-up to know what's going on with that person, whether they got reinfected.
Well,
what do you make of the fact that so many healthcare workers are being infected?
Because of lack of protective gear.
It goes back to resources.
It goes back to resources and difficulties with round-the-clock medical care, as Dr. Asare mentioned, in Africa.
Well, thank you. Thank you very much. Well, Dr. Asare and Dr. Akukwe, I want to thank you very much for your perspectives on this special edition of Africa 54. Now, Dr. Akua Asare is a commissioner from the Washington, D.C. Mayor's Office on African Affairs, and she specializes in psychiatry, health policy, and global affairs. Dr. Chinua Akukwe, a professor of global health and community-preventive health at George Washington University. Thanks a lot, and have a good night.